Welcome to Alio's Tutorials. Today, we'll show you how to insert a nasogastric tube with a local anesthetic. Materials needed: a nasogastric or NG tube. Lubricant, we're using Instella gel. Gloves. Syringes for the tube. A stethoscope. Tape, a protective pad, and possibly a collection bag. Step-by-step guide. Explain and get consent. First, explain the procedure to the patient and obtain their consent. Then, lay out all your supplies. Prepare the NG tube. For lubrication, we're using Instella gel as it contains the local anesthetic lidocaine. Measure the tube. To measure the correct tube length, hold one end of the tube at the patient's nostril, then run the tube along to their ear. From there, extend the tube in a gentle curve down to just below the sternum. Mark this spot on the tube. Lubricate and insert the tube. Coat the tube with lubricant. Then, carefully insert it through the patient's nostril while they are seated upright. Advance the tube. Gently move the tube 10 to 15 centimeters forward toward the throat. At this point, with the patient's head tilted slightly down, guide the tube past the entrance to the larynx and into the esophagus. If the patient has any breathing problems or pain, pull the tube back immediately. Watch for possible vagus nerve irritation, which can cause a slower heart rate. Coordinate with swallowing. Have the patient take small sips of water. Advance the tube further each time they swallow until it reaches your marked spot. Check the tube position. Inspect the throat area to make sure there's no coiling, which could indicate incorrect placement. Inject some air into the tube with a syringe while using a stethoscope to listen over the stomach area. If you hear a gurgling sound, the tube is in the right place. You can also check the position with a pH test or an X-ray, if needed. Secure the tube. Attach the tube securely to the patient's nose, cheek, and ear with tape. Document. Record the details of the procedure and the tube length in the patient's chart. Important note: for your first NG tube insertion, always have supervision from a colleague or an experienced nurse. Thank you for your attention.